Well, I've been a patient of Dr. Williams probably 20-something years, and over the years he's taken care of numerous different problems for me, from TMJ to numerous caps, and I guess it was probably a year and a half ago I fell in my driveway and cracked 2 of my front teeth, and we had to have some bonding done, and from that standpoint I had some discoloration in my teeth as well as from the caps. Plus, I had always had small teeth. My teeth were, my gums were lower onto my tooth, and I just was tired of the way they looked, and the discoloration really was beginning to bother me.
Believe it or not, Nancy was a patient of mine for 29 years. And she started out, she was a TMJ patient. She had some problems with her jaw joint, and we worked with her successfully for about 2 or 3 years, getting her stable and comfortable. And then she eventually went through some orthodontics, and she went through some crowns, just normal wear and tear type of dentistry that she had since she was a child. Some of her fillings had worn out. And as we worked with her over the years, she kind of always said to me, "I sure would like my smile to be whiter and brighter and more pretty." And she said, "I'm going to get around to it. I'm going to do that one day." And now it's been 29 years since I've been talking with her about that, and she came in the other day and she said, "It's time. I'm really ready to do this." And I think the impetus to do it was her husband. We had done his mouth about 3 years ago and finished him, and he was looking so good, she just said, "I need to be looking as good as my husband does."
Obviously, I would just love that perfect 10 smile, but most of all, what I wanted was my teeth to be functional, and for them to have the same color and size-wise was extremely important to me. And I just felt like that using the veneers was probably going to give me my best outcomes. I think what's really interesting is that my husband's really excited about it for me, because he knows how much over the years I have had struggles with different aspects with dental work, and he's just thrilled that I'm finally going to have kind of what I've envisioned all my life to have in my teeth. I just had to work through the process for me as to what I felt like I wanted, and it was just really important. As Dr. Williams will tell you, I asked him numerous different visits, hundreds of questions, and I just had to work through the process. I wanted my outcome to be one that would last me for a while, that the technology was there, and I feel like that's where we are now with the technology in dental work.
Ready?
Absolutely. Can't wait. Oh my goodness. I never dreamed they would be this beautiful. Far more than my expectations. Oh, they're gorgeous. Thank you. Thank you. I may retire from going to a dentist when he retires, but he's been a great as far as professionally, but most of all, he listens to what I have to say, to what I envision and what I want, and then he tells me this is what's reality and this is what we can do for you, and he gives you an opportunity to work that out in your mind and to feel comfortable with your decision.
I'm Lisa Luckadoo. I'm a patient of Dr. Williams and have been for about a year and a half. I am was petrified of a dentist, and had been since I was about 20 years old. I have driven past this office for 12 years, wondering if this was a good dentist to come to. So I started doing research on the website and found Dr. Williams, and the moment I started reading the website, I thought, I can do this. I can finally do this. It's my turn. I'm going to get my smile back. So I made 3 appointments for a consultation and canceled all 3, and made the 4th appointment and came in and was met at the front door by a young lady that said, "I'll take you around the office." Took me around the office, showed me rooms and everything. I started shaking. So I sat in the chair and waited and asked the girl to close the door so I couldn't hear any of the drills or anything, because I was just petrified. Sat there about 15 minutes waiting for Dr. Williams to come in, and was getting more and more nervous and scared, and thought I was actually going to be sick to my stomach. The moment he opened the door, my nerves just kind of did this. He has a compassion that I've never seen in a dentist before. He actually, within about 10 minutes, had me in the chair looking at my teeth and said, "We can fix this." And when he said, "We can fix this," I didn't believe him, because most of the dentists I'd gone to prior had always had something negative to say first, like, "Why didn't you take care of your teeth?" or "This is ridiculous that you've let them go so long." Instead, he said, "We can fix this."
It was just an issue with me as far as how my teeth looked, and as you get older, sometimes your teeth have a tendency to get a little, crooked. You lose bone density in your mouth, and then, there's gum disease that can set in if you don't take care of your teeth. So through all the steps and everything, I was able to cure everything that, the issues that I had going on.
It's been wonderful. I, smile all the time. I don't feel self-conscious to smile.
To have straight teeth finally, and all even in the appearance and everything, and I wasn't self-conscious anymore, and I could smile, and I didn't think that people were staring at me, like, "Oh, look at her teeth, they're crooked,"
It very much has given me my confidence back. I didn't realize until after I saw those pictures how much I really had stopped smiling, And when you realize how good you feel about yourself and you do have that confidence in yourself, in the workplace, you tend to start participating more. You start feeling very comfortable having face-to-face meetings, these interactions with other clients. It definitely is a huge thing for your self-esteem. It really, really is.
I'd say Dr. Williams is, a 10. He is. He does a lot in the community for a lot of other people, and his work is excellent. And it's a one-stop dentist office, so that you don't have to go see several different dentists. The bone grafting and the implants are, a lot of times you have to go see someone else to do that, and he does just about basically everything in his office that you need as far as dental work is concerned.